Are we starting?
Yes.
Okay. My name is Lauren Redding. This is my GI-GU assessment checkoff. I'm going to be doing this assessment on my mom. I wanted to preface and say that she wasn't comfortable with having her stomach shown on video, so I am going to be doing this checkoff through her clothing. I'm going to go ahead and start now. I have my stethoscope, I have my clipboard, and something to document any findings on. So, come in, knock on the door. Hi, how are you doing today?
Good, how are you?
Good, my name's Lauren. I'm going to be your student nurse. So I'm going to go ahead and the doctor ordered a GI-GU assessment for you. First thing I'm going to do is check to make sure that you are the right person. So can you go ahead and verify your name and date of birth with me?
Tanya Breed, 9/27/1974.
Okay, perfect. And do you have any kind of allergies that I should know about?
No.
Are you in any pain today?
No.
Okay. Do you have any religious or cultural issues with me doing this exam? I'll have to touch you and put the stethoscope on you.
No.
Okay. And is there anything that you're specifically worried about or any goals that you have for this assessment?
No.
Okay. So I'm going to do my hand hygiene and I'm going to start with my inspection. So I would look at the abdomen and look for any signs of lesions or scars, any distension. If there was distension, then I would measure that later with a tape measure over the umbilicus area. I don't notice any distension. There's no scars. Everything looks healthy and normal. I would come down to the foot of the bed here to look for symmetry of the stomach. Everything is symmetrical and it looks good. So I'm gonna need you to put your hands behind your head and kind of sit up almost like you're doing a crunch. Okay, and I'm gonna be looking on the abdomen for any kind of bumps or odd distension there, which would indicate presence of a hernia. I don't see anything like that, so everything looks good there. I'm gonna move on to my auscultation. So this here, and then I'm going to be listening to bowel sounds in all four quadrants moving in a clockwise direction. Okay, everything seems normal. The bowel sounds are neither hyper or hypoactive. Everything is in a good range. So I would also hear, from here, move on to, I want to check for any bruits and the aortic, renal, inguinal, and femoral arteries. You should not hear a presence of a bruit because that indicates that there's something going on, but I'm going to be checking for that now. Okay, sounds good there. Again, I don't hear anything unusual. Everything sounds good. So that finishes auscultation. I'm going to move on to percussion. So I would percuss in several areas in each quadrant of the bowel to listen for, we want to hear some dullness, some resonance. We don't want to hear anything that's too hollow because it indicates denseness of those organs. Everything sounds good. Don't notice anything unusual there. So then we're moving on to the final portion, which would be palpation. So I'm gonna be doing palpation and rotating in small circles in each quadrant, and then I'm also gonna palpate the liver and the spleen. The liver and spleen palpation is deep palpation, which is usually done by an advanced practitioner, but for the purposes of the checkoff, we're gonna be doing it here. So I'm moving around in each quadrant, and I'm feeling for any kind of odd distension or anything like that. We wanted to make sure to leave palpation after the auscultation, because if we were to palpate before auscultation, it could influence those bowel sounds that we're looking for. Okay, seems good. Then we're gonna do the liver. So what I'm gonna do is I'm gonna be pushing kind of hard. Did you notice any kind of tenderness when I was palpating? Okay. Let me know if anything hurts. I'm gonna have you breathe in and breathe out slowly. Okay, I don't notice any kind of inflamed presence or anything there, so the liver is healthy. Then I'm gonna do the spleen, which I'm gonna go like this. I'm gonna have you breathe in deep and breathe out deep again. Okay, again, I don't notice any sort of inflamed, bulging presence there, so the liver and spleen are also good. So did you notice anything that was particularly painful or tender? No. Okay, and then I'm gonna end this with just a few questions about your general health for this. Do you have any pain with bowel movements or anything like that?
No.
Any pain with urination?
No.
Okay. Would you say that your bowel and urination frequency is normal or accelerated?
Normal.
Normal, okay. Have you noticed any genital discharge that is out of the ordinary?
No.
Or okay. And have you ever been screened, diagnosed, or tested for an STI?
No.
Okay. Do you have any history of bowel or urinary issues, surgeries, complications, conditions?
C-section.
A C-section, okay. And everything went well with that?
Mm-hmm.
Okay. And you haven't had any complications from it so far?
No.
Okay. Well, that's going to be the end of my assessment. Do you have any questions for me?
No.
All right. Have a good day. Thank you.
Thank you.